Ladies and gentlemen, for decades, the true cost of healthcare has been hidden in fine print, confusing bills, and insurance loopholes. But that could all be changing. A new executive order aims to shine a light on medical pricing, and believe me, it's already sparking major debates in Washington and beyond. So the questions are who stands to win, who stands to lose, and more importantly, how will this impact you? So, what is the breaking news relating to healthcare? Well, in a move aimed at shaking up the healthcare industry, President Donald Trump has just signed an executive order directing federal agencies to enforce healthcare price transparency rules. Now, these rules that were slow walked by the previous administration. So, what's the goal? To force hospitals, insurers, and even pharmaceutical companies to disclose their real prices, not estimates, not vague cost ranges, but actual upfront numbers. That means that you, the patient, would know exactly what a procedure, a test, or a prescription costs before you get the actual bill. Right now, the price of a medical procedure can vary wildly between hospitals, and I'm talking about hospitals even within the same city. A routine MRI at one hospital could cost $500, while another one charges $2,500 for the exact same scan. And until now, patients had no way of knowing. So take this real life example. A patient in Wisconsin needed 2 standard medical tests. At one hospital, the bill was $1,500. At another hospital, just 30 minutes away, the same tests were only $405. That's a savings of $1,095 just by knowing the price and choosing the lower cost option. Excuse me. This is why price transparency matters. It puts the power back in the hands of the patient. Now, you wouldn't book a flight or buy a car without comparing prices, so why should healthcare be any different? And the potential savings are not just small change. A major economic study found that if these transparency rules are fully enforced, Americans could save, wait for this, a staggering $80 billion by 2025. Employers who often foot the bill for healthcare coverage could cut costs by 27% on the most common procedures. But here's where it gets complicated. Enforcing these rules hasn't been easy. The Biden administration was sued in 2023 for failing to enforce prescription drug price transparency, leaving many wondering if large healthcare corporations were just being let off the hook. The problem? Well, hospitals and insurance companies have very little incentive to reveal their real prices. After all, when costs are hidden, of course, they can charge more without competition. So, what happens when the government demands transparency? Well, in Trump's first term, his administration implemented historic rules requiring hospitals to publish their prices. But many hospitals found ways around it. Some posted prices in complex, hard to read spreadsheets, while others, well, they simply ignored the rules altogether. Trump says his new executive order will change that by stepping up enforcement and holding health plans accountable. This could mean serious penalties for hospitals and insurers who fail to comply. The polls show that Americans, quite rightly, are fed up with surprise medical bills. 95% of Americans say that price transparency is important, and 6 in 10 believe it should be a top government priority. So the message is clear. People want to know what they're paying for. Trump himself put it very bluntly, saying, Our goal was to give patients the knowledge they need about the real price of healthcare services. They should be able to compare prices, shop for the best care, and get the best doctor at the best price. Sounds reasonable, right? But enforcing this will not be easy. The big question is will hospitals and insurers actually follow these rules, or will they find yet another loophole? And will future administrations continue this push for price transparency, or will it fade into bureaucratic red tape? So, what does all this mean for you, the patient? Well, if this executive order is fully enforced, here's what you can expect: transparent pricing from hospitals and insurers, the ability to shop around for better deals on medical care, potentially lower costs for procedures, prescriptions, and insurance plans. But if enforcement falls short, hidden fees and surprise bills may just continue. And that's why staying informed matters, because healthcare affects everyone. So now we want to hear from you. Do you think hospitals and insurers should be required to reveal their real prices? Will transparency actually drive the costs down? Or will the big industry players find a way around it like they usually do? So drop a comment below. Let's talk about it. And by the way, if you found this breakdown helpful, please make sure to like, share, and subscribe so we can keep bringing you the news that matters most. Have a great day, guys.